I'd love to just hear a story of hope. So is there anything that comes to your mind as a really amazing client or patient transformation?
Yeah, I mean, we've seen it over and over again. Um, that a patient comes in, they have a diagnosis, they've gone through treatment, and one patient sticks out to me because it's kind of one of those stories that's the worst of the worst. You've got a triple negative breast cancer. You have metastasis to shoulder, scapula, ribs, lungs. I mean, multiple areas of the body metastasized. And what we were able to see with this, and the treatment was actually that chelator I was talking about earlier, combined with radiofrequency therapy and combined with a late stage chemotherapy. Um, that combination pushed this patient completely into what's called NED, which is no evidence of disease. And I mean, basically, I don't use the word cure. I don't, because to get to the point where your disease is gone, you have to maintain it. You have to follow certain guidelines yourself with recommendations when it comes to diet, lifestyle, supplementation, medications. And it's not something that's going to end. I mean, I think there's one of my mentors, Dr. Gio Espinoza. He's a big prostate doc up in New England. So I'll throw his name out there. But he says, look, you're always going to have cancer. This is a lifetime of treatment you have to work on. You cannot just treat it for 6 months and then forget about it. You can't give up. It's there. And he's harsh about that, because it's a reality. Is if we're going to win, if we're going to beat this, the goal is to take that life-threatening cancer and convert it into a chronic manageable disease that we can treat the rest of our life, our natural born life. And I mean, so far, that's what we're seeing with this particular patient. And it's a story that I love seeing, because there are tools that we can use that do work, and they can work very effectively for people, even when hope is lost, even when it appears that, nothing else has worked.